Well, good morning, good afternoon, good evening, depending on your time zone, and welcome to this webinar, The Digital Transformation Wave for Payers, Ensuring Regulatory Compliance and Reducing Cost of Care. My name's John Pigott, and I am the Managing Director for Innovaccer for our payer and life sciences industry sectors. I'm pleased to be able to moderate this webinar today, and with me I have two panelists, Greg Pastor, who's the Managing Director of Risk Adjustment Operations at Advantasure, and Mike Sutton, the Chief Technology Officer of Innovaccer. Greg, you want to just introduce yourself real quick and give us a little bit of background?
Yeah, thanks, JP, and good morning. So yes, I'm the Managing Director of Risk Adjustment Operations for Advantasure. I oversee our 360 risk adjustment professionals who really support our health plan and provider clients around managing their populations, improving the health of that population, but also improving the documentation of conditions that members have. We have a pretty innovative point of care provider engagement coordination solution that we'll talk about a little bit here that really is integrated in with providers' EMR processes and workflow to allow for improvement in the documentation and management of conditions. Prior to Advantasure, I worked on the plan side for about 20 years with Aetna, variety of roles, network, a lot of population health management. So look forward to the presentation here this morning.
Fantastic. Welcome, Greg. It's a pleasure to have you join us today. And Mike Sutton, do you want to introduce yourself and give us a little bit of your background?
Sure, JP, and thanks for having me. It's great to see you again, Greg. My name is Mike Sutton. I'm the Chief Technology Officer at Innovaccer. I've been here a little bit over a year, and although my title says Chief Technology Officer, I'm a self-proclaimed lifetime data nerd. My whole career really has been in the data space, not always in healthcare, but I've certainly been learning a lot from folks like Greg and JP who've been in the industry for a while.
मतलब उसको समझ नहीं आया उसने मुझे यही पिंग करा है ये वाला तो चला गया कोई बात नहीं उसको बोल नेक्स्ट वाला कर दे 15 मिनट वाला
Hi.
जितना छोटा कर सको ना उतना छोटा कर दो यार मतलब
Garima, can you
अभी भी बहुत बड़ा
Can you go on mute, Garima? Thank you.
Sorry about that. So like I say, so I'm a lifetime data guy, and I've been applying my wares the last 8 years in healthcare space, and learning from experts like my two fellow panelists. I entered healthcare 8 years ago at Kaiser Permanente, where I was their Chief Technology Officer. We spent a lot of time there, kind of modernizing the infrastructure, becoming cloud enabled, and probably most importantly is creating a data management structure. Prior to that, it was non-healthcare. I was deputy CIO at the Central Intelligence Agency, which you could imagine has a large data set to worry about, and very much like healthcare, it's the complexity and the yin and yang of protecting data yet being able to share it, which we all know is a big issue here in the healthcare space. And then prior to that, just a number of other industries. I was in the hospitality space, the oil and gas business, and kind of the aerospace business. So thanks for having me, JP.
Well, thanks for joining us, Mike. And I think your experience is going to be very helpful here, especially that CIA experience around data challenges. We're going to talk a little bit about data and data challenges here as part of the digital transformation discussion. So thanks for joining us, and let's move into the agenda. What we're going to cover in the next hour is, we're going to cover a current landscape of healthcare data, the impact of COVID-19 on the acceleration of innovation. We'll talk about digital transformation broadly in the payer industry and the opportunities arising from that trend, and then ways to overcome regulatory and cost challenges that we're all faced with. And then we will wrap up with some actual real live case study information that Greg is going to share with us, and then a little bit about the healthcare data platform that Innovaccer has. So before we get started, I just wanted, for the audience that's out there listening in, if you have any questions during the course of our discussion, you can submit those questions through the chat window, and we will address those as they arise and as we get a chance to talk about them. So feel free to submit those throughout our discussion. So let's get started. First of all, the world before the pandemic. I can hardly remember what it was like. It's been such a long slog for the past year. But where were we? A year ago. We were in a place where largely the healthcare leaders were focused on transitioning from fee-for-service to value-based care, really across all segments. But really, the maximum penetration that we've had is something on the order of 40% of healthcare leaders, say that they continue to move their efforts from fee-for-service to value-based care contracting. And we're not really making the progress we need. And we're going to get into this a little bit further. What happened with the pandemic, the early impact of the COVID-19 pandemic, it really highlighted a couple of key points, including lack of, real-time predictive business information and the lack of virtual care practices to assure safety and convenience at home. Lacked true interoperability between disconnected and fragmented systems. Lacked a 360-degree complete view of the patient. These are things that we discovered as we went. Lacked effective and timely coordination between providers, and lacked a true payer-provider collaboration. Those are a lot of the things that we saw here at Innovaccer. Greg, I want to just pull you in this discussion. Curious what you saw during the past year in terms of the COVID-19 pandemic impact to your business and your clients' business as you experienced it with Advantasure.
Yeah, thanks, JP. I think it is important. It's almost a year ago, it feels like, that the world changed, and the huge human toll caused by the pandemic that then was highlighted through the disconnected nature of our healthcare system, the requirement that you really have to see your doctor face to face in an exam room someplace, and the inability of many clinicians to really talk to each other effectively to help coordinate that care. The pandemic brought those things all out. And I think you saw, from March through June last year, that huge investment in enabling and improving virtual care to allow folks to keep getting the kind of care that they would need. So, we saw that tremendously here at Advantasure. I'm sure a lot of folks out on the attendees also saw that. But it's a sea change in terms of the use of virtual care, but also trying to change models of care, many of which were requiring face-to-face interactions. We saw that. We have a pretty big field team that works with providers to help manage their populations. A lot of that was face-to-face interactions, and we really changed that model to shift more virtually with providers, as well as enabling their technology to help manage patients more effectively.
Fantastic. We certainly saw a lot of that as well with our clients. And so the pandemic really exposed a few weaknesses. And as the topic of this webinar points out, we're going to explore how digital transformation can help impact some of those gaps. So transitioning on, if you look at digital and data trends in the payer industry, it's predicted that the digital revolution can save healthcare over $300 billion. I think the study by Accenture, said that industries it could save $60 billion in the long term by making the right technological investments today. And those are things like on-demand healthcare, blockchain, completely new thing, and expected to help drive data in the EHRs and reach a tremendous number of people and the tremendous costs associated with that, cost savings associated with that. Medical innovation with artificial intelligence, big data, facilitating and preventing preventative and predictive care, and then treatment through virtual reality, as we said. How can you treat patients in a safe and secure way, and provide a much better experience. Most of us would look forward to a 15-minute phone conversation, telehealth phone conversation with our primary care doctor than taking a half a day out of your schedule to go in and wait in the lobby and then see your doctor for 15 minutes and then drive home. So those are some of the things that we're going to, I think, to explore here, but I think I'd just open it up here to Greg or Mike. Any thoughts here? Any other key trends that you've seen?
I have, so I think these slides are great and they go into some specifics on this, but I think if you look at this, one of the underlying, common trends that we're seeing, it's not from a lack of having data. I mean, the EMRs created, we've just been through an era of getting the data digitized. We have, supply chain systems, ERP systems. People generally know what they have and where it is. To me, the key on this is how do you unlock that data within these, within your own organization? And of course, that is complicated by the fact that healthcare and the payer ecosystem is a bit fragmented. So I think a lot of this and much of what we're going to talk about, in the rest of in part of this panel is that interoperability need. Of course, we need to collect more information and we need to deal with it better, but there is so much. It's, to me, the key and one of the trends that is out here, what is the right information that we need to be able to share to find that $300 billion? And I think at least some of my, again, only 8 years of experience, but as we see more and more of these gaps closed in data, that's where a lot of that efficiency starts popping up. And so I just kind of want to recognize as, what is blockchain? Well, blockchain is a truly very creative way of sharing information, in the ether, out in the internet, and still being protected and safe. So a lot of these are fundamentally finding ways to share data more effectively.
Yeah, fantastic. Thanks, Mike. Well, let's talk about this. Let's dive a little bit deeper into some of these data challenges in healthcare. Just some metrics here. Over 75% of clinical data is currently in unstructured form. How do you get to that? Average clinical records today is approximately 80 pages long. U.S. healthcare system wastes $935 billion a year. There's 40,000 unstructured characters in clinical records. I could go on and on. Unstructured data sources are things like digital services, email, clinical notes, lab tests, imaging, third-party sources, wearables, those kinds of things. Mike, you've had a tremendous amount of experience in this area over the course of your career, both in the travel industry and the CIA and then healthcare. So what are your thoughts about this? What are people doing to really address these data challenges now?
Yeah, so one attribute here, the CIA people were lying to us, so we had to figure out the veracity of the data. And although people aren't lying in this business, it also is very important to find the veracity of this data. Veracity meaning, what's the trustworthiness of this information? And it's not like anybody's misreporting data or anything like that. I wouldn't make any of those claims. But as I think most all of us know, especially in the clinical space, the context and the semantics of clinical data is more sensitive than any other data set that I've had experience with in my times. And so what we're finding is, like for example, I'm no clinician, but your blood pressure is different when you're standing up versus when you're sitting down. You need to know the context of that when you're sharing these results, and then trying to run, like on that last slide, is a lot of the value of being able to do predictive modeling, be able to do artificial intelligence type assistance. those are highly, highly dependent on the context of that data and the semantics of that data. So, and when you look at it from a computer science perspective, you know, it's in a column, you know, it has a row, you could just use that information, but that really leads to unreliable results. So I think that's, to me, one of the biggest challenges, you know, is the ability to semantically normalize this data. And then the second one, which is kind of your second bullet there, you know, an average clinical record is 80 pages long. And in most of those cases, those 80 pages are coming from multiple sources. You know, you have the providers, you have the payers, you have the pharma records. It goes on and on and on. And what we're trying to do now is make these records or that, you know, the unified patient record around a patient more robust and add in, you know, some of the social determinants, because we all know that's a factor in all of our health. Well, that just keeps making that record longer and longer. And so, and all these systems out there, you know, God bless them for building out the digitization of that. But there wasn't at the time, you know, a consistent way of sharing that information. So as we start collecting this data, we not only now have to deal with the semantics, as I mentioned a minute ago, but also the syntax, because each one of these are in different formats, and the ability to normalize that, because there's hundreds and hundreds of these sources. So to me, that's, you know, kind of the variety and the veracity, if you remember the 4 V's in big data, are two of the biggest challenges in managing the healthcare information and making it available and active for, you know, business leaders and clinicians and so forth.
Yeah, very good. What just before we get off this topic, Mike, what are you seeing just in terms of trends as how various different organizations are trying to address those challenges?
Yeah, so being Innovaccer, being in, you know, the data integration business, and and with a pretty modest expertise in, you know, clinical data normalization, is we're seeing many clients, certainly Advantasure is one of them, that have taken on this challenge, because kind of the business of getting our record systems and, you know, the EMRs in place and the PBMs and all the transactional parts of healthcare, you know, are operating, you know, really well, actually. And, you know, I think we as an industry, we should be quite proud of that. But we're seeing a lot of progression towards, you know, going to some of the more advanced, you know, data hosting and data management capabilities that the cloud providers have enabled us. I mean, I think, you know, the what I would call horizontal data management that's come out of the big cloud providers, you know, like the Googles and the Microsoft and the Amazons, have given us a lot of tools to help manage the veracity and variety issue that I just mentioned. So it's, you know, from a trending perspective, it's really kind of a really good opportune time to go after, you know, the data management issues in the organizations in the healthcare space.
Very good. And you know, largely one of the things that I'm seeing, Mike, is you know, the cloud platforms certainly have helped us in terms of transitioning from on-prem legacy systems to much more affordable, efficient systems in the cloud. Yet those horizontal players, you know, our healthcare industry is very specific and very unique. And the ability to have a horizontal player address all the unique challenges of managing data in the cloud is, you know, really requires, you know, an additional focus and additional capability that maybe doesn't exist in the horizontal players. And I think that's, from my perspective, kind of where companies like Advantasure and companies like Innovaccer can fit in and add value over and above just, you know, sort of the horizontal cloud structure. You agree with that? What are your thoughts?
Yeah.
Yeah, well, I'm sorry, Greg, go ahead.
No, go ahead, Mike.
Well, I was just gonna, you kind of, JP, you kind of hit the piece down there. It's down there in that bottom line. A lot of the, you know, I was in the hospitality industry, and, you know, the data there is very structured. and the definition of that data is very well understood. It says 75% of the clinical data is unstructured. That's kind of the core of that problem. So I'm sorry, interrupted, Greg. I'll let you take it from there.
Yeah, I was just gonna, I think, agree with both of you that, I think the challenge is getting information in one spot, then linking it together and making sense out of a lot of that unstructured data to try to create some structure around it, apply algorithms to it to identify those opportunities to really impact and improve care.
Very good. Very good. Well, I think we're going to transition to talking about, what are the opportunities that we have in front of us, and we're going to explore a couple here. So there's two real categories that we're going to explore here in the next few slides. One is opportunity to resolve or address or meet regulatory challenges, and then the other is the opportunity to reduce the cost of care. Two major challenges facing payers today. And we're going to talk specifically about HIPAA data breaches and cybersecurity concerns, as well as the CMS interoperability mandate and those issues. And then we'll switch over to the cost of care side of the picture, and how do we address higher administrative costs, member referrals, and out-of-pocket costs due to leakage, et cetera, costs due to care gaps, and costs due to poor quality of care. So I know that on the data HIPAA data breach cybersecurity side, Mike's our big expert, and on the cost of care side, I'm going to look to Greg to share with us some of his experiences with AdvantaSure. So moving right along, regulatory challenges. This is a HIPAA data breaches and cybersecurity concerns. A lot of data here to look at, but kind of the net of it is incidents, data security incidents, and hacking has been growing by leaps and bounds as we have continuously gone more and more digital in the healthcare industry. The leading cause, as I said, is hacking. You can see the chart, from 14 to 2020, how that has increased significantly. Then other major causes are, ransomware or malware attacks, unauthorized access to the system, and then loss or theft of protected health information and unencrypted electronic PHI. Mike, we're gonna. I really want to look to you to understand. In your past as CIO and Chief Technology Officer, especially at Kaiser, I imagine this is one of your top concerns. What were the things that you did to really address these? So
I think certainly the regulatory challenges, and it's being driven by regulations, but I think first and foremost that an organization's responsibility to its members and its customers is that trust that we are going to manage their data with certainty. And I think that's a relationship that's, in the healthcare relationship, based on, the early days of clinicians, is you trust your doctor. You need to trust your health system. You need to trust your payer, your insurer. You need to trust those providers. And then I think, certainly, the government has done a very good job into helping us interpret that trust in very, very specific type of regulations, and a penalty system for not following that. So, and then I will add that in the organizations I've been part of, that it really, from the board of directors to the chief executive office, it is that trust with their membership and their customers was the highest priority, to the point where it's a common topic. Because as you mentioned, JP, these are the incidents, the slides you're showing, these are incidents that actually the hackers were able to penetrate or actually make an effect. That number is 1,000 times bigger of the attempts that happen every single day. And so some of the things you've done, and we've done as an industry for a long time, is, you've got to get your network perimeter secure. But that, that is certainly your first line of defense. And I would say the second line of defense, and where I've always felt very strongly, is not all of your data in your network is privacy data. And so, and many organizations, it's very hard to differentiate. So, you know, if you remember the old days of castles, you know, there was a moat while people went inside the moat. Then there were walls inside of that, and then there was a tower. I think you have to take that same principle when you're talking about data management in highlighting what that data is, that, you know, we can share zip code data with people. It's publicly available. We don't need to protect it like it is my personal information or my healthcare information. So this concept of, first of all, being able to properly manage your data and classify it is not, in my experience, is not wholly done today in the healthcare space. And then I think thirdly, the first was the network, second was the data management. And then thirdly, I think is the realization that most people now that I've been talking to in the industry have recognized that the public cloud systems, you know, again, with the three biggies and other providers as well, has a very robust security program around it. If you know, we used to compare the number of security folks we had, you know, at Kaiser Permanente versus the number that Amazon Web Services or Microsoft Azure has, and it's 10 times, 100 times bigger. And because this is their specialty in their business. And so a lot of those, you know, whether it's HIPAA compliance, the services that are being engaged on these clouds have already been through that certification. And you can inherit some of the controls that they have put in place in order to get that. So, you know, to me, it is defining, it's kind of going to that three levels of whether you think of the old-time castle, but getting those three levels of security and understanding what is the most important thing to be protected.
Very good, thanks. Very good insights for sure. Let's explore the CMS interoperability challenges. You know, there's been a whole series of interoperability mandates that have come out for CMS, all I think with the best intentions about providing transparency and access to data by patients, and transparency to the physicians networks, et cetera. But that creates, you know, sort of a growing volume and variety of data leading to these kinds of interoperability issues. And then how do you drive synergies across multiple silos like we talked about before, given that you need to somehow expose that. So, you know, and then of course, management of data collected from multiple sources, including direct from consumers. You know, how, you know, that poses a lot of challenges. And when it's a regulatory driven thing, it tends to be one of those painful, you know, Band-Aid, ripping the Band-Aid off kind of experiences for payers, because it may not in the short run add a ton of value to what they're doing, but they must do it to conform. I know that we're involved in many implementations as we speak, implementing the CMS 9115F interoperability mandate. Mike, I'm sure you've been in discussions with many of our clients and in the industry. What are your thoughts and observations on these kinds of regulatory mandates?
Yeah, so I agree with a lot of your comments there, JP, on, you know, kind of the challenges. But I think before we start, and what I think we all have to keep in mind, because this is quite a bit of work for us, you know, within the industry to be able to produce these FHIR APIs. But to me, the strategic ramifications of having these APIs, and I'll just go back to when I was in the travel industry. I mean, I was part of the Open Travel Alliance, you know, I can't believe I'm going to say this word, at the turn of the century. That makes me really feel old. But it's like at the turn of the century, and and that started with the development of just 4 APIs in this open travel alliance between, airlines, rental cars, myself in the cruise industry. And think about it now, that industry, and there was pain back then too, because people had to produce these APIs, but that industry has transformed itself. It is self-service now. It is, available on your mobile device. And so, and it created an amount of transparency and pricing and a competitiveness in this space. And to me, I take all those words I just said and parallel that to the healthcare industry, which I think those are some of the same things that we can benefit from this. So me personally, again, as a self-proclaimed data nerd, these APIs are to me the foundation, from a technology perspective of transforming the healthcare industry in the U.S. Now, having said that, the APIs are, we're only on version 4. They're, there's 142 of these FHIR resources out there today. I'm not sure exactly what the final number is going to be, but it's going to be more than 142. So, so it's not going to take care of all your data interoperability needs, but it does it takes a good share of what I would consider those things it takes to create a 360 view of a particular patient's healthcare, ecosystem. And then, so the fact that they're not totally robust yet, that's one thing, but certainly we're rolling them out. And then I think the second part is, well, not all the source systems to create those APIs are available. So there's a lot of work and rummaging through a lot of data to be able to produce those. That's creating kind of work for a lot of our customers and clients, but then kind of go into this endpoint of what these APIs can produce. And then I would say the third challenge and the final challenge is these APIs, of course, are regulation, but from a application development standpoint, they're a doggone good idea. And I don't think a lot of people have seen that. Certainly some of the more innovative companies, certainly Greg's company have jumped on the idea of taking advantage of these APIs, but we're seeing kind of slow adoption from the app developers in these particular spaces. So I would kind of say those are the 3, things that are, that are challenges in order to implement the vision that, certainly CMS came up with.
I think another thing is going on too that I think will continue to drive this kind of transformation forward, and that is, even though these are government mandate rules or regulations, that apply to the government program, Medicare Advantage, Medicaid, ACA, et cetera, it doesn't necessarily apply to the commercial business yet. But I think that combined with the fact that a lot of healthcare is now, I'll call it being driven by consumerism and the consumer experience. And those, sort of the government regulatory push, as well as the consumerism experience push, is going to drive these kinds of capabilities around transparency and cost, et cetera, to where now a payer, to be able to differentiate themselves in the market and shine, will need to be able to offer these kinds of capabilities because the consumers are demanding it in order to move forward. So that's I think that's happening as well.
Couldn't agree more, JP.
Okay, let's continue moving forward. So, we talked about regulatory challenges and, with digital transformation, we set up an IT infrastructure, implement and maintain secure on-demand information exchange, aggregate standardized data. We've talked about all this. Streamline things like prior authorizations, allow information to be exchanged through electronic files, implement blue button type of capabilities for patient access and member access to their structured and standardized healthcare data. So all of these things, as I said, are driven by regulation, driven by consumerism, and I think we'll continue to see that expand. So next topic that we're going to get into is going to be the cost thing. But before we do that, we have we have one a poll that we want to pose to the audience, and that is, we just talked about all this, and so we're curious as to what are your biggest regulatory challenges in payer digital transformation. We're gonna transition to a poll, but is it HIPAA, PHI, PII regulations? Is it CMS guidelines and compliance? Is it cybersecurity and data threats, or is it something else? Curious. I think we've opened up the poll, and we will give it a 1.5 to 2 minutes for you all to answer those questions. But Greg, while we're waiting, what are your thoughts? What's Advantagers thinking about this whole consumerism movement, and how are you trying to add value to your payer clients with respect to that kind of consumerism movement in the market?
Yeah, JP, I might pick up on a few threads from you and Mike, where there's regulation pushing payers and providers, and then there's members and patients sort of pushing for a better experience. The bar for member experience in healthcare is not high. You look relative to other industries, it's not particularly high. CMS, I think recently with like the STARS program, is pushing more and more for payers to pay attention to member experience. They're like skewing the STAR ratings a lot more towards member experience in terms of rating health plans. So this is where we're trying to get in, help our health plan and provider organization clients, some of whom bear risk, really address more of that member experience. So when they ultimately get evaluated by CMS, they're coming out shining and get that 4-star rating. But members, I think, are demanding more. The regulatory environment is also demanding more, and so we're trying to support our health plan clients through improving that member experience, making it easy for members to access care, to get their questions addressed, and really understand what their care should be.
Very good. It's kind of you're right. It's a low bar. From my personal experience, and probably reflects a number of others, consumers of healthcare, is that if you could just make it simple and easy to make an appointment, not have to wait half the day in the lobby to see your doctor, and then have a clear understanding as how your bill gets paid and how much you have to pay. If there was just a simple, smooth process for those fundamental things, it would make the consumer experience so much better. And those are simple things to do in most industries, but somehow much more difficult to do here in our healthcare industry. As I said, mainly due to the fact that all the things that we've talked about, the distributed data, many different systems, your information as a consumer is represented across multiple systems in the community, and very hard to have somebody, a single physician, be able to see all of that at one point in time when they're seeing you. So
hey, JP, one thing I'd add, kind of as we've been deploying some of our clients on the FHIR APIs to meet the CMS regulation, one part of that is you have to solicit consent from the actual consumer or patient, and the regulation, of course, is a regulation, and so there's a lot of room for interpretation in that. But what's been very positive, I think, in that, the negative part is it's a little unclear what we have to implement, but the very, very positive part of this is now the payers are going through and actually thinking about what is our relationship with that consumer and the ownership of that data. So it really is driving, to me, some of the very decisions that needed to be made to kind of stimulate that consumerism you were both talking about. And it's interesting to watch kind of different interpretations of that, and the consumer's involvement and doing that, and allowing access to their data.
Yeah. Okay. Well, how are we doing on the poll? Do we have any results yet?
We do, JP. And it's a deadlock. Number one is the HIPAA, the PII, PHI regulations at 41%, and exactly 41% are the CMS guidelines and compliance. And then general cybersecurity threats is at 18% with 0 others.
Well, that we represented the entire spectrum then in the top 3. Any surprises with those results?
You know, I was obviously thinking that HIPAA and PHI regulations probably be a little bit higher, but you know, they're so conflated. I think maybe with the CMS guidelines and compliance, but I thought that was going to be kind of the runaway winner.
Yeah, interesting. Okay, well, so definitely the top 2 are on front of everybody's mind, and as you said, Greg, you know, the CMS is so much right in everybody's grill right now because we've got deadlines facing us starting, you know, penalties starting on July 1st. So everybody is scrambling right now to ensure that they get their ship righted, so to speak, with that. Okay, let's continue on. And so we've talked about the you know, the sort of the data challenges with regulations and privacy, security, et cetera. Now we're going to switch over and talk a little bit about digital transformation and its impact for the cost-related challenges faced by payers. We talked about this a few slides back around higher administrative costs, member referrals, out-of-pocket costs. You know, excess billing and insurance-related administrative costs, almost $500 billion in healthcare payers in the United States each year. And you know, evidence is showing that the United States is spending twice as much as needed on the administration of healthcare. And that's something that it seems to me that we ought to be able to fix. And then failure to manage member referrals and patient leakage, you know, results in loss of revenue, you know, and out-of-pocket costs like deductibles and co-insurance and co-payments, you know, for covered services, costs, you know, that aren't covered, all things that add to higher costs. And in fact, like we were talking about, the consumer experience, you know, a bad taste in consumers' mouth because of it. So we're going to talk about 3 different areas here. One, cost related to payers due to care gaps. And this is the, you know, the discrepancy between, you know, a best practices protocol in healthcare and the care that is actually provided to the patients. And, you know, what the 2 main drivers of that being of overspending or failure of care delivery and failure of coordination, and leads to, you know, escalated costs based on mismanagement of chronic diseases, excess emergency room utilization, and inaccessibility to care at the right time. Greg, this is an area where AdvantageSure is very focused on driving value with your health plan clients. Any observations, any additional insights here on some of those costs that are due to these care gaps? I know that you guys try to close those on behalf of your plan clients.
Yeah, we do. I mean, this is, I think, one of the biggest areas if we go back to the last few slides in terms of the opportunity. Aging population, as folks age, you know, the burden of illness goes up, chronic illness goes up, and it's the kind of thing that can be managed but not cured for the most part. So it's ensuring that clinicians know when someone is seeing a patient, what they need to do to take the right evidence-based steps on that care. You know, whether it's the clinician face-to-face or like a care team who might be supporting from a health plan perspective, you know, on care coordination. But I think there's a huge opportunity here. You know, as the population gets older, the burden of illness goes up. These are things that don't get cured, but they can be managed. And that gets to sort of the cost piece. And then if you think about kind of the member experience, like getting people better healthcare, from a plan perspective, will make those people like value their plans, stick your members and stick your customers. So there's the cost of care piece, but there's really doing the right thing for the member, getting them the right care that ultimately leads them to value their health plan a lot more than they're doing today.
Very good. And some of it is just, in my experience, just a little bit of an educational factor there on helping them understand what the proper care plan is, and providing, communication and transparency to the patient on why you're doing what you're doing, because it's the best proven healthcare protocol for what they're going through. Just be able to, expose that and be transparent and educational helps the patient have a better experience as well. So all good points. So care gaps are one piece. Another piece is cost due to a poor quality of care. Poor quality of care, really exposes the healthcare system to a tremendous amount of excess cost, and mistakes and early deaths, et cetera. It's all bad results. Effects of poor quality or poor workflow, over the utilization of the ER and the ICU, surgery delays, or risk of failure of key health aspects of a patient based on the fact that they're not getting to the doctor on time. Longer lengths of stays and increased infection rates, all these ultimately lead to higher cost. Greg, curious as to what Advantasure is doing in this space to improve quality. I know that the care gaps is one aspect of it, and to be able to ensure that we keep people on the right care plan. But are there any other aspects that Advantasure is looking at in terms of looking at how we address care quality?
Yeah, so very specific to care quality, things like evidence-based measures of care. A lot of people know them as the STARS measures. And serving those up to clinicians at the point of care, or the care team, quite frankly, because it's not always just the doctor in the exam room, it's the MA, it's others around that care team. So they really understand what's the right evidence-based measure of care. Has the person received it? And if not, then it's prompting that action so that member, that patient, from the provider's perspective, is getting the right care. And if they do that, they're better managed, and then all those bad things don't happen. They don't end up decompensating. They don't end up in the ER. If you end up in the ER as someone over 65, it's a pretty high likelihood you're going to get admitted to the hospital if it's something medically related, and it just starts that cascade. So if you can help that care team and that member understand what their quality of care gaps are, address those, it can then prevent all those downstream impacts.
Great, thanks. Appreciate that. So really summarizing, reduce the cost of care through digital transformation. The ability to really impact the appropriate care, the right care through a care protocol at the right time for the right patient, and then the ability through data to identify and analyze things like social determinants of health. I think Mike referenced that earlier in our discussion. Make faster healthcare decisions with artificial intelligence and predictive analytics to be able to get at high-cost patient cohorts. Optimize operational activities, automated member authentication validation. We talked about the consent management that Mike referred to earlier. Those all go into it. So we talked about the closing of coding gaps with artificial intelligence driven technologies to be able to sort of sift through the clinical information and derive a potential coding gap. All of those things are areas that digital transformation can make an impact. And I think what we want to do now is actually
Hey, JP,
yeah.
Before we leave this slide, we had a question related to this about what are the infrastructure changes needed, to be compliant with, both the CMS regulation and the security thing. And so I think this is kind of an interesting point that you don't need to do a big forklift upgrade of your environment. I think you mentioned earlier is, there's a lot of legacy systems in there that can produce this type of data and information. So I don't think in order to meet these requirements, you need to rebuild your entire infrastructure. I think, and I've kind of mentioned this a couple of times, but the focus is now more on creating that data management environment and then the ability to message and move this data throughout your infrastructure, and more importantly with your business partners, whether it's your providers or your patients or your membership. So and then the reason it ties into this so well is you don't have to do those things. You can brute force this. It doesn't have to be an elegant solution. But what you're going to find is it's just going to drive costs up, because that's really what we've been doing for a decade, making things interoperate with each other using what I would consider brute force methodologies. The new platforms that are again coming in through the cloud hosting environments makes that a lot smoother and easier. And by the way, and this is mostly my humble opinion, but it's a fraction of cost of kind of maintaining and owning that infrastructure yourself. So there's actually a cost element of moving to these newer data management techniques as well. Thank you for the question, by the way. So
yeah, thanks for that question, and thanks for that answer, Mike. It's interesting that you're right. We could brute force this and meet the requirements, but the cost would be much higher than if you're looking at something that is a common data platform, source of truth, especially if it's in the cloud, that can integrate with all your data sources and bring all that information together, then expose that data through a secure third-party driven application through a FHIR API that is in the hands of a consumer that can first log in and or a member, log in and authenticate themselves, provide their consent, and then transfer data or download their own data themselves. And that's what I know. That's what Innovaccer's focused on delivering in that CMS regulatory interoperability space. So it's a good question, good point, and duly noted. So let's continue to move forward, because we do have another poll, and that is really to understand which of your cost-related challenges can payer digital transformation help solve. We talked about administrative costs, we talked about out-of-pocket costs, referral costs, or costs due to care gaps and poor quality, or if there's something else. So we'll open that up and allow people to weigh in and give us their opinion on that. And then in the meantime, while we're waiting, I think I talked about the things that Innovaccer is doing in the CMS world. I think we're also working closely with Advantasure in that as well. Greg, what would you think if you saw this? What would your poll answer be from your seat at Advantasure? What would be the biggest digital transformation impact?
So I think a lot about the cost due to care gaps and quality. Clearly, there's opportunities to move administrative costs, but when you look at where the healthcare dollars are spent, a small portion is spent on administrative. It's meaningful. I mean, billions and billions of dollars in this country, but the bigger swath of expense in healthcare is really around medical expense. So, I think if we get digital transformation right, help enable clinicians to manage their patients better so they've got a good profile on folks, it will ultimately impact the cost of care. So I think a lot about item 4. I hope it doesn't sway the poll at all. I think a lot of these other things are clearly important.
Yeah. Mike, you have any observations?
Well, I don't know. If one of the leading industry experts say it's cost due to care gaps, that's where my vote's going. Hey, there is one other question, JP, if we have a moment. There was a question about what are the kind of the standards to follow in the cybersecurity realm of things, and I think that's a quick answer if you don't mind if I
go for it. Yeah, while we're waiting for the poll, we can address that.
So there's a number of certifying agencies out there. I think probably everybody's familiar with the SOC 2, Security Operations Control, version 2. I think almost every facility needs to have that type of thing. And then of course in the healthcare, and that's independent of healthcare. And then there's a HITRUST, and that is very specific with a lot of controls that need to be in place. And that is very specific to healthcare. And so those are two very important things. And providers need to be certified in those particular with those particular guidelines. But the other one too, that because the cloud providers, one, are in the business of protecting people's data and information, is highly leveraging whichever cloud provider you use, their security controls and security advice, and I would say some lessons learned based on kind of my experience with this and since the beginning of cloud computing is, I think there was early on days where many of us in the IT business didn't really, we didn't trust the cloud providers, but I think it's become abundantly clear they are the experts in protecting data in the cloud. So I would highly leverage their tools, techniques, and native services as well. And again, thank you for that question.
Thanks for that, Mike. Very good. So it looks like we have our poll results back. Yeah, Mike, you want to run through that?
Well, Greg called it, and I'm sure with no influence on the poll, but 54% the costs due to care gaps and poor quality, followed secondly at 31% with the administrative costs. No votes for out of pocket and no vote for referral, but 15% on others, which of course we don't know exactly what that is.
Right.
But it seems Greg called this one.
He did indeed. So listen, we have only a few minutes left. I'm going to, this is sort of a summary chart of what we've already talked about. So I'm going to go skip through this one because what I really want to give the opportunity for Greg to do is, we've talked about a lot of these areas for improvement through digital transformation, but I want to look at some of the real world examples of digital transformation at work. And I know that Greg, through AdvantageSure, has had some tremendous success with specific clients. So, one is around provider engagement through real-time alerts. Another would be chart retrieval, electronic chart retrieval, and the other, finally, closing care gaps. And so I'd like to turn it over to Greg to just take us through these three client case study examples and what they were able to achieve. So take it away, Greg.
Great, thanks, JP. So, since 2013, we have been working with providers around supporting the management of their populations, but historically it was through like a very concise one page, and it was paper, view of that patient, so they could understand the gaps in care that person had that need to get addressed in that 10 to 15 minutes that a doctor has a visit. And working with Innovaccer, we've now taken that capability into the provider's EMR workflow and process. So, person comes in, the doctor understands pretty concisely what needs to be addressed from that member. And it kind of goes beyond what a lot of, I think, the EMRs do by themselves, which is, here's what the doctor knows about the person, to here's what the ecosystem, all the doctors know about that person. So that clinician and the care team can take action at the point of care. So starting last year, it was actually, I think, accelerated by the pandemic. a lot of our physician practices had much more of an interest in having information integrated into their EMRs. For sort of our first pilot practice that we launched, we delivered gaps at the point of care. Doctors did a great job addressing those gaps, and it allowed for that real-time exchange of information between sort of ourselves and the physician practices, so they could manage members better. Beyond that, beyond just getting the information in front of the clinician. So if we go on, I think onto the next slide, JP. Part of what we also do as our program is we'll review the progress notes, not only for those dates of service, but for other dates of service, to ensure that if the doctor's clinical intent was, a person had diabetes, that it gets documented in the record. This year, we're going to do about 2.3 million of those types of reviews. But through some of the work that we do with Innovaccer, we're now able to get that information sort of extracted out of the provider's EMR, where we can then also apply other techniques to that, NLP, et cetera, to reveal sort of further truths about the information in the chart. But this is a big area of cost for us. So, we're now able to get the information electronically, a pretty comprehensive picture of the member, allowing for things like medical record review, and in a way that doesn't put burden on the physician office, their administrative staff.
Okay, and then finally, but certainly not least, you had some great experience and results in closing coding and care gaps in real time. You want to talk about that?
Yeah, so when we ultimately serve up information to the providers, we saw that they took action on about 80% of those gaps, and they closed them. And that's actually pretty good. We never expect 100%, because there's just certain things that, like, you need to order a follow-on test. You can't diagnose it at the time, so you need to kind of order that follow-up test. So we had great gap closure by the providers. Really reduced the cycle time for retrieving medical records, and reducing not only the burdens on the providers, but the burdens on us. So, improvements in gap closure, and then reduction in some of the administrative costs. And I think getting back to our poll numbers, those were sort of like our 1 and 2 in the polls. It was improving gaps and reducing administrative expenses and burdens on providers.
Very good. Excellent results. Well, I think we've run over by just a couple minutes. So on this summary chart, I'd like to first of all just thank my panelists, Greg and Mike. Thank you very much, and thank the audience for weighing in today. And we look forward to continuing the discussion. So thanks for your time, and have a great afternoon.
Thanks for moderating, JP.
Thanks, JP. Be well, Mike.
Yeah, Greg.